Hi everyone, my name is Emily Sebald and I'm a mental health therapist, so that is what I will be talking with you about today. So I wanted to start by just talking about where I started. So I actually started in the same seats that you guys are in now, maybe not literally because I know you're probably at home watching this, but I was a student at Barbara Worth and then I moved on to Brawley High and I graduated and then went to a 4-year university after that. So I did 4 years at San Diego State for my bachelor's degree. I actually started out thinking I wanted to be a nurse, and that didn't pan out because I'm not good at science, turns out. And so I kind of made my way to social work somehow, just through talking to different counselors and all of that. So if you're feeling like I don't know what I want to do, or you're worried about not choosing the right thing, the good news is you can always change your mind. I did, and I still finished in 4 years. So after that, I decided I needed to get a master's degree because I decided I wanted to be a mental health therapist, and you need a master's degree in order to do that. So I moved on directly after that to my master in social work degree. And I never in a million years thought I would be the type of person to get another degree directly after finishing college, but it was kind of what I needed to do. So I did do it, and I found that I really enjoyed getting my master degree because everything I learned was things that I was going to use or were things that I was going to use in my career. So I found it very interesting. So school came a lot easier to me at that point because all the things I was learning I was actually going to utilize in my job. So after I finished the master's degree, I worked for about 2.5 years in different community health programs. I worked primarily with children and teens who were struggling with depression, anxiety, PTSD, post-traumatic stress disorder, behavior issues, all kinds of stuff, all across the board, just a lot of different mental health issues. So I did that, and during that time, I was being supervised by a licensed social worker. And so after about 2.5 years, I was able to have enough hours to sit for an exam. I sat for that exam, and I did pass, thankfully. And after that, so this was about 2 years ago that I did that, and I'm now a licensed clinical social worker. Basically what a license does for you in this field is it allows you to practice independently. So I'm able to have my own private practice if I choose, and I don't have to be supervised by anybody. I can provide those services to people without anyone being my boss, basically. So that's kind of where I'm at now. And then what I do on my day-to-day basis is I actually have a private practice now. I do that part-time on the side. So like after work or on the weekends, I see clients with anxiety or depression, or I'll work with parents as well who are struggling to manage like young children, like 5, 6, 7-year-old children, their behavior issues. So I do that part-time, and then during the day, Monday through Friday, my day job, I work at a hospital in a primary care clinic, and I work with a lot of different primary care doctors. If someone comes in and maybe they came in because their foot hurt, but then they end up telling the doctor that they've been feeling really anxious, then the doctor pulls me in and I talk with that person and I help them identify maybe some different things that they can try to help reduce some of the symptoms they're having mentally. So not only anxiety, but I also work with people who are having sleep issues or pain issues, and I kind of help them understand where their symptoms are coming from and make suggestions on ways that they can hopefully feel better. So I do that during the day. I might see up to 12 people a day. That's a very busy day. Usually it ranges between 6 and 12, but lately I've been very busy. I think just with this pandemic, there's been a lot more people who maybe previously were controlling their anxiety or depression. But with all the added stressors, like a lot of people are losing their jobs, just in general, a lot of the things that a lot of us used to do that helped us to feel mentally well or calm or relaxed, like maybe going out to eat or spending time with friends, going on a trip, those types of things aren't as readily available to us as they once were. And that's kind of thrown a lot of people through a loop. So lately, it's been a lot of people coming in saying, well, since like about March, which is when the pandemic hit, I've been experiencing this or that. So lately, it's been a lot of helping people to find new ways of coping, new ways to manage their mental health symptoms. So that's kind of what I do in my day job. And then, like I said, I do see other clients at night, and I'm actually doing teletherapy, which is kind of a new and becoming very popular thing. So I actually sit where you're seeing me now. This is in my house. I have this little Japanese divider behind me, and this is where I actually do therapy. I do it through my computer, and I talk to my clients just like I'm talking to you right now. So the first appointment is always an assessment. It's about an hour and a half to 2 hours. And I ask questions about what the patient is currently experiencing, maybe if there's any history of mental health issues, if they have a trauma background, like if there was anything in their life that was traumatic for them, and because that may be affecting their current symptoms, family history of like medical issues, mental health issues, and just how their relationships are with other people. And then, of course, I always assess for safety concerns about being a danger to themselves or anyone else. So that's what the assessment looks like. After that, we kind of talk about what are your goals for therapy. So what do you want to get from this experience? And then every appointment after that is just helping them to develop healthy coping skills, because we all have coping skills and way we deal with things, but they're not always healthy. So teaching them different ways that they can cope in a healthy way, and helping them just gain more insight into what is causing what's going on for them. And yeah, that's basically it. The reason I chose social work is because it's so broad. There's so much you can do with it. If I wanted, I could go work in an emergency room, assessing people who are potentially a danger to themselves or others. I could also work in a school as a school counselor. I could also, this one's actually really cool, I could ride around with a police officer as part of a psychiatric emergency response team. I would ride around with a police officer, and we would respond together to any incident that had a potential to involve mental health. And then I would use my mental health skills to work together with the police officer to make sure that person is both safe, but also is getting their mental health needs addressed. So as you can see, it's very broad, and I get bored easily, so I think that might be why I chose it. But I am very happy with my career, and if you did have any questions about this, you could always ask your teacher, and maybe they could pass along those questions to me, and I'd be happy to answer any of those for you. All right, I hope you guys have a great career day. Thank you for listening.